All right, changing gears right now. February is American Heart Month, and it aims to raise awareness about cardiovascular disease, the leading cause of death for men and women in the United States. And joining us this morning to share his insights on how we can protect our heart health is Dr. Tariq Haddad, a board-certified cardiologist with Virginia Heart Medical Practice. Thank you so much for coming in. We commonly hear about the importance of knowing your numbers. What exactly does that mean?
So there's several numbers that you can easily find from your primary care doctor and your checkups that really have a profound effect on predicting your risk of heart disease. And those numbers are pretty simple. They're basically your blood pressure, trying to hopefully get to blood pressure 130 over 80 or less, having a blood sugar that's well controlled. We look at a number called hemoglobin A1C. We'd like it to be under 6.5. Your weight, getting to a body mass index that is about 25, and you're knowing your cholesterol, specifically your bad cholesterol or the LDL.
Understand they added a new number to the list. What is this new number, and what role does that play?
Yeah, so a lot more attention has been paid to this another portion of the cholesterol called lipoprotein A. We usually abbreviate it LPA or lipoprotein A. LP(a). It's a very, very powerful predictor for heart disease. It's hereditary, so it's passed on from your genes, from your birth parents. About 1 in 5 people in this world actually have a high lipoprotein A. It affects 1.5 billion people in this world, so very, very underappreciated, and it can triple or quadruple your risk of heart attack or stroke compared to somebody with a normal LPA.
How do you find out your LPA?
Very simple, just a blood test. That's it. Just get it. You just have to ask for that blood test or talk to your primary care doctor about it. It's easy to get.
Was this something that doctors just weren't paying attention to, or was it truly just kind of discovered? If so many people, over 1 billion people, have this high number.
We've known about this for many years, actually, for decades. What we didn't know was how best to treat it is the issue. We knew it increased risk, and we're finding out more about that. We knew also that if you had it, your risk was so much higher over your lifetime that you had to double down your efforts at controlling those other numbers that we talked about. It's just getting a lot more attention because there are now exciting medicines potentially available that can bring it down to normal.
And so is it medication that can help you lower the numbers, or is it a lifestyle change as well?
So approved medicines right now do not really bring it down to normal in the vast majority of patients, but there are medicines now in late-stage clinical trials that can lower those numbers by around 80 to 95%. Very impressive. And those trials, those studies right now are looking to see if lowering that LP(a) can actually bring down your risk of heart attack and stroke.
And so I'm wondering, is this something that older people need to be concerned about, or at what point in your life should you start worrying about your heart health?
So I think at any point, so the guidelines now suggest everybody should get this tested once in their lifetime. It really doesn't change over the course of your lifetime measurably.
So one time in your lifetime is when you need this test? Okay.
Correct. Yeah, it doesn't measurably change with lifestyle factors, but it's important to know because everybody should know a factor that could potentially triple or quadruple the risk for heart attack.
And so if you had to give one piece of advice when it comes to heart health, I know this is Heart Month, Heart Health Month, what would it be to those out there listening, particularly those who've said, look, I've done the lifestyle change, I'm dieting, I'm eating right, I'm working out, and still I might be on the cusp of, okay, the danger zone. What do you say to those people?
I think I think what I like to tell my patients typically is nobody is perfect. Everybody can improve on something, and just focus on the basics. Don't make things too complicated. Try to make sure you're getting 30 minutes of daily physical activity. Make sure you're eating a Mediterranean diet, and try to find new ways to improve that. More fish, more vegetables, more olive oil, more tree nuts, and just really try to eat a healthier diet overall, and try to improve it every year is what I usually tell my patients.
How often should you be getting tests to kind of study your cholesterol level and all these other factors you mentioned? Should that be yearly, like your physical, or
yeah, typically once a year is a good starting point. If they're not controlled, you may need to get it checked more often than that.
All right, great tips. Of course, we are paying attention to our health, particularly this month with the heart health. We are looking for information. If you'd like it right there, it's at virginiaheart.com. Thank you so much, Dr. Haddad, for coming in.
Absolutely. Happy to do it.
And, of course, folks can also reach him, right, if you have any more questions. Appreciate you.
Absolutely. Happy to help.
All right. And coming up, Valentine's Day, speaking of heart.